Fetal alcohol spectrum disorder, or FASD, describes a range of effects that can occur in an individual who was prenatally exposed to alcohol. The effects can include physical, mental, behavioral, and learning disabilities. FASD is a lifelong brain-based disability that impacts individuals, their families, and society. For educators, it is critical to understand that prenatal alcohol exposure may cause a differently structured brain, and that in most cases no physical or facial characteristics are visible. According to the updated Canadian FASD diagnostic guidelines published in early 2016, there are two medical diagnoses of FASD: FASD with sentinel facial features and FASD without sentinel facial features. For FASD with sentinel facial features, there are three criteria. First, three specific facial features must be present: a shortened eye opening, a smooth or flattened philtrum, which is the groove under your nose, and a thin upper lip. Secondly, at least 3 of 10 assessed brain domains need to show a significant impairment. The brain domains include motor skills, neuroanatomy, neurophysiology, cognition, language, academic achievement, memory, attention, executive function, affect regulation, adaptive behavior, social skills, or social communication. Finally, there needs to be reliable evidence that the alcohol exposure occurred during pregnancy. However, with this particular diagnosis, if the three facial features are present in a severe way, the diagnosis can be made without the confirmation of alcohol exposure. Another key piece of information that we want to share about this diagnosis is that it is relatively rare. In a survey of over half of the Canadian FASD diagnostic clinics, only 2.1% of individuals assessed received this diagnosis that was formerly known as fetal alcohol syndrome. Now, for FASD without sentinel facial features, 2, 1, or none of the facial features need to be present. According to the literature, the majority of individuals do not show any of the facial features. As with the first diagnosis, at least 3 of the 10 brain domains must be impacted in a significant way. It's important to note that the facial features do not reflect the degree of the brain disorder. And finally, with this diagnosis, there needs to be reliable evidence of alcohol exposure during pregnancy. When we understand the criteria for an FASD diagnosis, and the social stigma that exists with FASD, it becomes clearer why so many of our students may never see the diagnosis and/or are often misdiagnosed with other conditions. For more information about the 2016 update to the Canadian FASD Diagnostic Guidelines, please visit the displayed link. Here are some key understandings about FASD. Research clearly shows that prenatal alcohol exposure may disrupt or alter the way the brain develops. The developing brain is vulnerable throughout pregnancy, and various parts of the body may also be impacted depending on the timing and the amount of alcohol exposure. The learning and behavior challenges that we often see in our students may be directly connected to difficulties in specific brain domains, like memory and attention. As was mentioned earlier, in the majority of cases, there are no physical characteristics evident. FASD is largely an invisible disability. No two brains are impacted in the same way. The level of impact is determined by various maternal factors such as age, health, genetics, nutrition, and others, as well as the timing and the quantity of alcohol consumed during pregnancy. There is insufficient scientific evidence to indicate a safe minimal amount of alcohol to consume during pregnancy. There is a significant social stigma that still exists with this condition, so we must practice sensitivity and understand that no woman purposely sets out to hurt her baby. Another important message for people to know is that an injury can happen as early as 3 weeks of pregnancy, a time when most women do not even know they are pregnant. With this understanding, we begin to make links between brain function and behavior. As educators, we start to look beyond the behaviors and look for underlying causes for those behaviors. An important question we need to ask is, are the behaviors we're seeing intentional and willful, or just a response to not being able to meet the expectation? This understanding leads us to an approach that focuses on knowing our students and supporting the areas of need, rather than reacting or responding punitively to the observed behavior. It is this FASD-informed approach that will help educators to develop a web of support that will enable our students to have more success at school.